Type 1 diabetes and Ironman triathlete don't usually appear in the same sentence, but Iron Andy Holder, a Type 1 since 2006, combines them to show the world, and kids with diabetes in particular, that they can live without limits. As you might expect, Andy's in great shape due to his rigorous training for Ironman events. His A1C is always in the mid-6s, but he hadn't changed his basal insulin rate in years, and never looked at the accumulated data stored in his pump, meter, and CGM. When he did look at the numbers with CDE Gary Shiner, founder and president of Integrated Diabetes Services, he was surprised by what he found, how much he could improve his daily insulin routine, and how much better he could treat his diabetes.
Since sitting down with Gary and actually making some tweaks to my pump and making some minor adjustments, what I found is that my postprandial, or 2 hours after I'm eating, I'm not having the spikes that I was having. And I have heard that even if your A1C is good, if you're having huge spikes between meals, that's not necessarily good for your body.
At Integrated Diabetes, we believe that everyone should have access to good education, good guidance to help manage their disease.
I think because my A1Cs were always so good, I kind of fell into a lull of complacency.
Andy is truly a special guy. The things that he's accomplished and the work he puts into his diabetes is exemplary. He's not that unusual, though, in that most people with diabetes will go to their healthcare providers who will really just look at their A1C and say you're doing well or you're not doing well. And that doesn't really tell the whole story. A1Cs don't speak to the quality of a person's blood sugar.
It puts you right about here on average, in that 130, 140 range. And you can get to that kind of an A1C with daily blood sugars that look like this, or you can get there with daily blood sugars that look like this. And the A1C has no idea how much bouncing around you're doing. It only knows what the average is.
And again, living with it day in and day out, I know the difference. Glucose levels that are bouncing up and down a lot can produce a decent A1C, but it doesn't mean you're living well. When those blood sugars are out of range, it affects your physical performance, your mental performance, your emotions. There are a lot of day-to-day quality of life issues affected, and those have to be taken into account. There's also growing evidence that variability in glucose contributes to long-term complications. So even though the A1C looks good, we have to look at the details. Managing insulin-dependent diabetes involves countless decisions on a daily basis. And we're trying to teach people how to be an artificial pancreas unto themselves, how to match their insulin to what their needs are. And those needs vary considerably from day to day and within the same day. Matching insulin to food intake, to levels of physical activity, to emotions and stressors and hormonal changes that take place.
Well, like most people who have type 1 diabetes, we have a lot of gadgets, insulin pumps, continuous glucose monitors, blood sugar meters. It had been at least 3 or 4 years since I looked at my insulin pump and made any adjustments at all to my basal settings, to my carb to insulin ratios, to my sensitivity, to the timing of day that I'm giving myself, different carb to insulin ratios. So there's a lot going on. There's a lot to do with a pump. There's a lot of programming that you can do, and I wasn't taking advantage of any of that.
Technology has become our friend in a number of ways. Technology's provided tools that we can use to manage blood sugar better. The analysis of information is as individualized as the person is. Everybody has their own unique set of devices that they're using. They also have a unique set of needs and interests. There may be some folks who are really just interested in preventing hypoglycemia. They're having too many lows, so we'll focus our efforts on that specific area. Others are involved heavily in sports activity. We're going to focus on that.
Since working with Gary, making some minor adjustments to my pump and to my settings, I'm not having those extreme highs between meals, and the fact that I'm actually able to see it on the Dexcom, I know that to be the case.
When we start working with a client at Integrated Diabetes Services, we often will set them up on an ongoing coaching type of a service. So even though we have an initial appointment, whether it's face-to-face or through the computer or through the phone, we might interact with them on a daily basis for a while.
Peaks look modest. You don't seem to be spiking up all
I'm
that
doing
much.
much better. My mom has been so proud of me. I've been trying more and more to bolus before eating.
Taking a look at their data, answering their questions, helping them to fine-tune many of their settings, and also provide education along the way. Well, I'm lucky to have a team at Integrated Diabetes Services that works great together. We have nurses, dietitians, exercise physiologists, even a psychologist, and we're able to provide a full realm of service for our clients, and we work collaboratively. And one other little secret I'll share, every one of our clinicians has type 1 diabetes. By learning to manage diabetes effectively, you can save yourself immense cost in terms of healthcare expenses, prevention of complications, prevention of hypoglycemia, and just learning how to make effective use of the tools that you've obtained, whether it's a pump, a sensor, a meter. That can go a long way as well. It cuts down on unnecessary supply costs that you might not otherwise need. If we can help somebody make a smart decision about choosing a device like a pump, it can save them quite a bit of money for the next 4 or 5 years.
If somebody like me, again, who is so diligent, who is in such tight control, can benefit from a service like this, well then, I think there's a lot of people out there that really should take a hard look at how they can do something like this and, improve the management of their disease. And I would recommend anybody who either wants to get better control of their diabetes, or if you're an athlete out there that wants to take your game to the next level, that Integrated Diabetes Services is something that you should really consider, because even just with small changes that I've made over the last couple of months, I'm already seeing an improvement in my performance.
At Integrated Diabetes Services, we see our job as educating and empowering our clients. So our job is to teach patients both the pros and the cons of the various forms of technology and allow them to make an educated choice.